Clinicians have been asking a great question. Do I really need telemental health training? If you think about it, clinicians have been providing telemental health ever since COVID-19 hit. They basically haven't been having problems. It's been going great, actually. They have video meetings on a regular basis with people. They know how to use the phone. They know how to use websites, et cetera, et cetera. So why get telemental health training? Well, that word need pertains to a legal ethical question. So legally, is there a law that requires that you get trained in telemental health? Well, particularly you want to look at licensure law. So do the licensing boards that regulate the services that you provide, do they have anything specifically to say about telemental health? They may or may not, but you want to look at those regulations. And even if they don't say anything about telemental health specifically, all of them say to only practice within the boundaries of your competence. So the question is, are you competent in telemental health? You may or may not be. And that gets into the question of ethics. But before we go there, I want to show you where to get information on the legal aspects of telemental health. So to find the regulations around telemental health in your state, on our website, we have a page that covers that. At the top of this page, we look at a bunch of laws pertaining to telemental health for all states, such as privacy laws, breach notification laws, TerraSoft, mandated reporting, etc. And then if you scroll down, we list all the different states. So if you click on the state where you're licensed, and then you click on your profession type, you can see whether or not your state board says anything specific about telemental health. And again, they may or may not. So that's a really good place to start. But then the other question gets into ethics. So you want to look at the code of ethics for your profession. And we have a page that covers that. So you click on your profession type and you'll see the codes of ethics pertaining to your profession. And you can see what they say specifically about telemental health. We also have practice guidelines listed on that site. So ethically, we know, again, we're only supposed to practice within the boundaries of our competence. And to do that, it requires that we assess our own competence. And then if we are not competent, right, we have to determine what training or supervision do we need to get in order to become competent. That's where things get really tricky. You probably practice within a specialty area. Let's say you provide addiction treatment, or you provide play therapy, or couples therapy, or family therapy, or therapy to those who are experiencing trauma or eating, eating disorders. So you know that there's clinicians that also provide those services, but they have not really adequately been trained in those areas, which can really cause harm and cause problems. You know that, right? So telemental health is not rocket science. It's not like becoming a play therapist or something like that, but it does require some basic training. So the other question is, well, what competencies should be covered in a telemental health training? So for one thing, you should know the basics, right? So that you're able to assess your own competence. Now, to come up with these competencies, we look at, what do all the state boards say? What are the professional associations say? What does professional literature say? What does research say? What do the experts in the field say? And then we put all that information together in a way that is up to date. So if you want to find out a little bit about that information, look at the research and the literature, et cetera, take a look at this blog article we have on telebehavioral health competencies. You'll find that really informative. Now, one of the benefits of certificate programs, and you might be asking yourself, do I really need a certificate or certification or credential or an accreditation? And what's the difference anyway? Well, there definitely are differences between those terms. Those terms are misused a lot by organizations providing this kind of training. But the basic idea is, a credential in telemental health gives people some assurance that you're likely to be competent in the area. So if you think about licensure, just because you have a license doesn't mean you're competent. It means you're more likely probably to be competent than someone who's not licensed, right? So it helps someone determine whether or not you're likely to be competent. And training institutes like ourselves, we do the heavy lifting to figure out, okay, what competencies need to be covered? Let's make sure it's up to date and accurate and so forth. So that getting a certificate program, it's covering all of those essential competencies for telemental health. Now, it's important to look at who you're being trained by. Is it up to date and so forth? But if you look at our THTC program, Telemental Health Training Certificate Program, that's the purpose of that program, right? And you can look at the topics covered. So what should you know? Well, you should have an overview of telemental health, right? Where everything's kind of touched upon, but then really understand the legal aspects and the ethical aspects and cultural competency in using technology, how to select technology, how to configure it, what's the workflow, screening for fit, emergency management planning, privacy law, the clinical skills of actually providing sessions by video or phone, how to handle difficult situations when you're in a session with a client. All these things are really important. We see that clinicians sometimes fall into error because they think that because they use technology in their personal life, they can use it for healthcare and they're competent in doing it, right? Like their video skills or preparing a client or preparing their workspace and how to handle privacy issues. Or if you do this, if you look up, if you try to find a psychotherapist in your area and you look at their websites, often they'll have their email address listed or they'll have a contact form that you fill out. And those usually are not secure ways to be communicating with prospective or current clients, right? So clinicians often just don't know the technicalities of telemental health. And again, it doesn't take long to learn this stuff, but it's really important because this is where we are and this is where we're going. If you have any questions about what you ought to know about telemental health, how to figure it out, what courses would be most applicable for you, maybe you've already been trained in telemental health and you're not sure what else it is that you need, call us and we'd be glad to help you with that.